Let's be sincere, most nursing students freak out immediately they hear write a nursing care plan. It sounds overwhelming, time consuming and complicated, right? But here's the truth. Once you understand the structure and the logic, nursing care plan become one of the easiest in nursing school. So in this video, I'm going to walk you through from the stages of assessment to evaluation, how to write a nursing care plan, so that at the end of this lecture, you will say, wow, this makes sense. Hi everyone, I'm Beatrice. In this video, I will show you how to write a nursing care plan in a very easy way. So if you're ready for today's lecture, let's begin. When we talk about nursing care plan, I see it as a roadmap, something that helps you think like a nurse, that help you organize your care and ensure that your patient get the best possible outcomes. To understand nursing care plan, you need to understand the nursing process. So when we're in school, they tell us nursing process, we use the acronym ADPIE. A stands for assessment, D stands for diagnosis, P stands for planning, I is for implementation or nursing intervention, and E stands for evaluation. So you need this nursing process. You need to analyze each of them to help you think like a nurse and to be able to bring out a plan for your patient. We will look at each of them as you analyze a case scenario. In nursing school, at times they may not give you a case scenario, they will just say write a nursing care plan. But it's still the same thing. It's just your ability to think effectively, your ability to reason like a nurse and think of what you can do for your patient. So first, let's look at the case scenario and then we'll begin to apply the nursing process to be able to write out a good nursing care plan. Now, the case scenario here is a 68-year-old male is admitted with fatigue, dizziness, and shortness of breath on exertion. He has hypertension and sometimes forgets to take his medication. The vital signs include blood pressure 160 over 95 millimeter mercury, pulse is 100 beats per minute, respiration is 22 cycles per minute, oxygen is at 94% on room air. Now, they told us that the skin is pale and warm, and he says, I feel so weak that even walking to the bathroom makes me tired. So this is the case scenario we have for this patient. We're going to use the nursing process to analyze it and bring out a good nursing care plan. Now, first, the assessment. When we say assessment, that is the first phase of the nursing process. So we're talking about gathering data, gathering information about the patient. So this is where you take history. So when a patient comes to you for the first time, you want to gather information. You want to know the chief complaint and link it to the previous medical history. You even at times associate it with the social history, family history, immunization history. You gather as much information. At this stage is also where you interview the patient properly. You want to gather as much information to help you make a good judgment. So during this assessment phase, there are two types of data we need to collect as nurses. The first one is the subjective data, and the second one is the objective data. For the subjective data, is subject to the patient. So think of it like what the patient tells you of either how they feel or what they've done about themselves, things that merely looking at the patient, you may not really say this is what is happening to this patient. Let's take, for example, pain. Pain most times is subjective to the patient. Even if you see, maybe you notice facial grimacing, you will feel that this patient is in pain. You may not really know exactly how serious that pain is. It's only the patient, the subject, that will tell you this is how I truly feel. So subjective data are data that the patient presents to you. They are data that the patient, you collect from the patient themselves, so how they feel. So if you look at this scenario here, the patient tells you, it says, I feel so weak, even walking to the bathroom makes me tired. So when the patient tells you, I feel so weak, now you may look at the patient, you see their gait, you see their movement, it looks as if it's really hard. But you need to confirm this with the patient. Other subjective data from this case scenario can include fatigue, dizziness, shortness of breath on exertion. These are things that the patient will tell you. Even if you notice that you are thinking in your mind that this patient is short of breath because you see the way they are breathing, the way they are not comfortable, or you notice and feel that this patient is fatigued, it's better you get it from the patient. If they are alert and oriented, they can communicate with you. The other one is objective data. So that's what you, the examiner, collect from the patient. You can collect this through using techniques of physical examination like inspection, palpation, percussion, auscultation, and also checking vital signs. You can gather objective data like the blood pressure. For instance, in this patient case, we were giving vital sign of blood pressure, the pulse, the respiration, the oxygen saturation. These are examples of objective data because you have to measure this to be able to say this is what is happening to the patient. Another part of objective data could be what you feel when you palpate. Maybe you palpate the patient's skin. You could say, okay, the patient's skin is warm to touch, it's cold to touch. With what you also inspect with your eyes, the patient could look pale, like as is stated here. So these are some of the examples of objective data. What the nurse, the doctor, whatever that has to do with investigation or observation or measurement, they are all objective data. The next phase of the nursing process is diagnosis. So nursing diagnosis describe how a patient is responding to their disease process, not the disease itself. So how they are responding to that condition is what we mean by nursing diagnosis. When I mean the disease process itself, that's the medical diagnosis. So for example, hypertension, heart failure, heart attack, these are examples of medical diagnosis. But how a patient responds to those disease process is what nursing diagnosis is. Let's say, for instance, it can be activity intolerance, it can be airway impairment. Nursing diagnosis has a format. Most times, it's either in three parts where we have the problem, we relate it to a cause or etiology, and then we bring out the evidence, what the patient is showing or presenting at that time. Now, we also have a two-format nursing diagnosis where you have the problem and you just relate it to the cause. So, for instance, when we say risk for this, risk for that, most times it's just a two-part nursing diagnosis. Now, for nursing diagnosis, you don't need to cram it at all. If you look at the NANDAC diagnosis list, you see the problem itself, you see the related factors. Now, most times you are the one that maybe put the evidence based on what you are saying. Now, like I mentioned, most nursing diagnosis of three parts. We have the problem, which is P, we have the etiology or the cause, and we have the evidence. Now, for this patient that have hypertension, not taking their medication, blood pressure is high, and also patient report feeling short of breath or mild exhaustion. So a problem can be something like activity intolerance. This can be the problem. Now, the next part is etiology, which is the E or the cause. So for this one, we can say decreased cardiac output. Now, how do we know the etiology can be decreased cardiac output? From the history, the patient has hypertension and the patient forgets to take their medication. Even the vital sign shows that the blood pressure is high. So the patient heart is working harder because of hypertension. Obviously, afterload is increased. So afterload has to do with that force the heart has to overcome to push blood into the circulation. And when the heart is working harder, there's going to be decreased efficiency in the pumping action of the heart. And that means there will be decreased oxygen-rich blood, or less oxygen will be supplied to the body. The patient is going to manifest those signs and symptoms like shortness of breath, fatigue, dizziness, and that's what will be our evidence. So our evidence here will be shortness of breath, fatigue, even dizziness. Now, once you have known your diagnosis, the next thing is to plan. Of course, when you plan, you have to set goals, SMART goals. That SMART stands for specific, which is S. M has to be with measurable. It should be something you can measure to see that your goal that was set was achieved. And then the A has to be something achievable. So you can put a short-term goal and a long-term goal. For a patient in this situation, for this scenario, short-term goal can be the fatigue can be resolved within 24 hours of nursing intervention or within maybe 12 hours of nursing intervention. The long-term goal can be maintenance of normal blood pressure, maybe within 3 weeks, 2 weeks, because you want it to be achievable. You can't say the patient will maintain stable blood pressure within 1 day or no, because it has to do a lot of work, taking medication, checking diet, exercise. So you have to set a specific and achievable goal. Then we have the R. R stands for relevant. Whatever goal you are setting should be relevant to the patient, should be applicable to the patient. And then time plan, you have to put a time frame. You won't just say a patient will maintain normal blood pressure without putting a time frame. Is it going to be after 1 year, or is it going to be within a week? So there should be a time allocated for that goal you have set. Now, the next one is intervention. So intervention or implementation. This is where you implement those plans. You've written out something, what you intend to achieve, how to fix the problem. Now, during the intervention, you mention the thing you are going to do and give the reason. That's the scientific rationale. Now, one of the interventions we can do for a patient with hypertension is to monitor vital signs. In fact, if you don't know any intervention, the first thing that should come to your mind is monitor vital signs. Why? You want to know the baseline of the patient. Also, you want to know if there's changes, is there improvements or there is not. Another intervention can be encourage rest in between activities. Why? The patient feels short of breath or mind exertion. So you want to, as much as possible, help them to conserve that energy so that they are not overexhausted. And of course, another intervention that is so important in this situation is to administer antihypertensive. This is a patient that have hypertension that is not controlled. So you can't write this nursing care plan for such scenario without writing that you will give or you will administer prescribed antihypertensive, and the rationale will be to lower that blood pressure and also to improve cardiac function or cardiac output. Now, another one is health education. So for this scenario, the patient forget to take their medication. So a good nursing intervention is health teaching. You will teach the patient about adherence to medication, taking their medication as prescribed. And why are we doing that? Is to control that blood pressure so that the blood pressure is not consistently high. Remember, uncontrolled blood pressure is a problem. It can damage the heart, it can damage the blood vessels, it can cause stroke, it can cause a lot of issues. So you need to health educate the patient. Also, diet. You need to health educate the patient about diet, like for instance, low sodium intake. All this is to improve cardiac function and to control that blood pressure. Now, the last one is evaluation. For the evaluation, you want to check those goals you set, those interventions you carried out, were they effective? For the evaluation, for instance, if the goal is met, the patient can say, oh, I feel less short of breath, I feel less tired or fatigue, even when I walk on a longer distance. That's an example of goal being met. So you can say patient reports less fatigue on walking on a longer distance. Also, if the goal was met, the blood pressure should improve. At least it should be lower than what it was. The vital signs should be more stable. But if the goal was not met, you are going to reassess the patient and make a new plan or readjust some of your plan. And finally, the nursing care plan or whatever you are doing for a patient is not complete without documentation. So you have to document. Remember, whatever is not documented is not done. So you have to document that this was what was done and this was the outcome. So the overall care plan will look like this in a table format. We have the assessment, you look at the subjective data and the objective data. We look at the diagnosis, activity intolerance related to decreased cardiac output, as evidenced by fatigue, shortness of breath, dizziness after mind exertion. We have the planning, the short-term goal like reporting decreased fatigue in 24 hours. We have the long-term goal like maintaining normal blood pressure, tolerating activity before discharge. And then the intervention is listed here too, like monitoring vital signs. It can be every 4 hours, it can be every 2 hours, depending on the acuity of the patient case. The essence is to just, you want to know the baseline, you want to detect if there's any new changes, if there is improvement also. Another one is to encourage rest between activity because you want to prevent overexertion. At times, you can also cluster care. You do most of the patient care at the time where they have more energy so that to reduce that constantly disturbing them or stressing them. Then administering antihypertensive, which is very important to help control that blood pressure, and teaching the patient about medication adherence. So when the goal is met under evaluation, you are going to put that goal was met, like less fatigue, patient is able to walk short distance, even longer distance without being tired or feeling dizzy. And you can also bring out the blood pressure. For this one, for instance, the BP now reduced to 130/85. At least there is improvement. And even the saturation is even better, 97%. So this is how nursing care plan looks like. So that wraps us today's topic on nursing care plan. If you find this video useful, please like, leave your comment, share this video to others that will benefit from this video, and subscribe to this channel for more educational videos. Thanks for watching.